Good afternoon, everyone. This is John Pallett with Senior Enrollment Solutions. It is just about 1 o'clock. I will begin here shortly in regards to Agent Workshop Part 3. For those of you who have not attended Workshop Part 1 or Workshop Part 2, due to COVID, summer, whatever it may be, that's not a problem. Workshop Part 1 is on YouTube. It's under the SES Agent YouTube channel. If you have not gone on to the YouTube channels, know that we have two. We have one for consumers, for the most part, Senior Enrollment Solutions, and then we have one for the agents, SES agents. So Workshop 1 was going over Medicare basics, Medicare 101. If you didn't need to attend, great. If you needed to attend or you just want a refresher on Medicare, low-income subsidy, extra help, etc., then certainly tune in or certainly go back and watch that 45-minute webinar that we put on. Workshop 2, which we recently had, was online apps, telephonic skills, stalls, objections, getting through that first 8 seconds, which is so crucial when you're making any kind of phone call to book an appointment or to close a deal. So if you have not or were unable to tune into Workshop Part 2, certainly reach out if you're unable to find the link, but they're all under the SES Agents videos in YouTube. And today, Friday, September 25th, we are going to go through the last step to all of this. So Workshop 1, you figured out Medicare. Kudos. You know how to understand someone's level of LIS. Workshop number 2, you made it through the app. You sold someone. Hooray, you did your job. So now the last part to that is keeping your consumer on the books, and more importantly, generating additional referrals out of that book. And let me explain why that is so important. So to begin, first and foremost, let's go through polishing up your business. Are you running a business? If you owned a tire store, you'd know damn well what's in your inventory. You'd know what tires sell most. You'd have a good stock. You'd have all of your clients' records. You know roughly when they purchased, roughly how long they would keep a tire in general, right? You know that Doug, who comes in every 3 years, buys the top of the line Z-rated tires for his Camaro or Corvette or whatever it may be. You would have those in stock, and you'd have an employee calling Doug 2 years and 9 months out saying, Doug, how are those tires? You want to replace them now before summer begins? And you'd be upselling them. What's your AEP game plan? AEP is within technically a week away. What is your game plan to have a successful AEP or OEP for the health agents that are tuning in? And are you prepared for AEP? So lastly, increasing referrals, and that really is the golden ticket consumer. So to begin, I began health sales in 2005. I moved into the Medicare when the Affordable Care Act hit in 2009. We haven't looked back. So it's been over a decade now that I have been assisting consumers telephonically for the last 8.5 years with their Medicare, Medicaid, life insurance, retirement needs. I figured out obviously early on how to obtain and write more referrals than most agents write business. And that is true. I see the production. I know what agents write across the nation and through carriers. And frankly, I have just done the slight extra effort to create that rapport with that consumer for them to want to send me their book of business or send me their loved ones for me to create a book of business. I figured out and implemented the little things that keep consumers referring others to me. And this last year, not to gloat by any means, but I had my 10th referral down. Now, guys, understand it took me a decade to get there, but 10th referral down. Understand how deep that referral goes from coast to coast of. And I guess my one thought for you is, how many other referrals did I get along the way from the closest person all the way down? So understand how I build that referral business and why I build that referral business. So first and foremost, understand what your job is. Your job, step one, is to find a consumer anywhere, everywhere you possibly can. Step two, perfect your calls, perfect your script, market your hiney off. Understand that you're a marketer 90% of your life. You're only an agent about 10% of the time. You need to market yourself to let everyone know this is who I am and this is what I do. Know your stuff. You need to be a professional. Get prepared so that way you're never surprised. It never feels like a first date with a consumer. Your next step is you need to get in the door. Once you find the consumer, get in the door, either via phone or via in person, but create that predictable phone script to allow for you to get into the house or into their home or over the phone. 3, I consult. I do not sell. I don't sell anyone. The best thing that a consumer can ask you is, how do I enroll? What's my next step? I build that relationship and I'll show you how, but it really only takes an extra 3 to 5 minutes per sale to create that relationship. The problem is many agents don't have that 3 to 5 minutes, right? You're out the door onto your next appointment. I grasp that. But that 3 to 5 minutes is so important to build a relationship with them and not just be this wham bam agent that they don't even remember, and nor do you a year from now. Follow through, follow up, cards and calls. I cannot emphasize that. Nowadays, it's not really calls, it's more emails. You can automate this process to provide your consumer a 90-day, 6-month, 1-year email, but more importantly, it's that initial phone call afterwards. I need to make sure that you have your cards and your paperwork. More importantly, I need to make sure that you have my cards, my paperwork, and if something goes awry, something doesn't smell right, that you're going to reach out to me. Lastly, repeat step 1, just simply with a referral. Is your desk, your car, your contracting all in order? You have 6 days until pre-AEP begins, October 1st, which means at that time you can begin running medications, shopping prescription drug plans, and Medicare Advantage plans. My goal between October 1st and October 15th is to knock out a majority of my book of business. The reason being, you can't write the app. I get it. Before any of you start chatting in, you cannot physically write the app until October 15th. But I can tell off running your medications that it appears as though the Humana Walmart plan's the right plan for you. So on October 15th, I'll begin the application, which then sends the consumer over the email. They complete the email and we move on with our lives. WellCare, Blue Cross, all these online apps, you can prepare to get them written. My goal, however, is after October 15th, the only thing my clients have to say to their friends and loved ones is how amazing I am, that I buttoned all this up for them, that I helped them with the most confusing part of Medicare. So contracting, certifications, first and foremost, need done. You got 6 days technically till this all begins. Is your timeline, your schedule, is it written on your wall? Are you able to tell people no during the annual enrollment or open enrollment period? Do you have scripts near you? Do you have a script? Are you able to read through that script without sounding as though it's being read? And can you make it through any objection responses or stalls? If you're questionable on what a stall or an objection is, go back to our previous workshop from last year, or you're more than welcome to visit the SES agent portal where I've listed out the 7 stalls and objections. There's only 7. Do you have power phrases near you? If you don't know what a power phrase is, go back to our previous workshop. But once again, it goes back into the psychology of the sale. And if you need help with that, let me know. But those power phrases are what I combat or come back to a consumer with if necessary. You found a plan? That's great. Which plan worked out best for you, Harold? Oh, I found Blue Cross. And then the conversation goes from there. Is your computer and your phone charged? Do you have enough voicemail usage if necessary? Do you have a product, information, and applications? Do you know now how to write either telephonic or online apps? If you do not, reach out. We'll help you through Ascend. We'll help you through Lean and setting up your PURLs, your personal URLs, to then email out to that consumer. So oftentimes, my emails are simply out to the consumer saying, hey, Debbie, thank you for your interest. I've ran your meds, or I found a Medicare Advantage plan for you. Click here to enter WellCare's link, or click here to enter HAP's link, or Molina's link, or Mutual of Omaha's link to complete that enrollment. Are you certified? Are you ready to take an application within the next few weeks' time? Avoid a two-step process because you're not prepared. My calls, hopefully, are one call closes 99% of the time, and assume the close. The reason it's a one call close is because I assume that we're going to take care of business. Work a consistent work week. Get yourself on a schedule and keep it. Whether or not you work some in the morning, some in the afternoon, some in the evening if you need breaks, whether or not you just want to work until noon, whether or not you want to start work at 6 p.m., that's all fine to do, but stay consistent. Pre-qualify your consumers so you're not wasting your time. Really important. Do they have a retirement plan? Can I move them? Is their rate less expensive because they're grandfathered in than anything I can help them with? Be prepared, be efficient, and understand that your time is money. Every moment that you're sitting in that office chair, you better be doing something that's productive, that's helping you increase your business. This is not an area to be watching YouTube, playing video games, etc. Get your mindset in the mindset of making money, helping your community while I'm sitting here. Otherwise, don't be sitting in that office chair at your desk. Leave the emotion out and understand the psychology of how all this goes down. This is a psychology game. Knowing that it's summer 2020, many of us were on Netflix watching shows. One show came on that was really interesting in regards to a famous basketball player, and one of his teammates said he didn't figure out the game. He figured out how to play within the game. And that was something that really struck home to me. This is never emotional. It's not. It's a psychology game that I'm playing with someone else. I'm playing with this consumer. And the more you figure out that psychology behind it, mirroring your consumers, taking control of conversations, the funner this industry becomes. And it just really is a game every time you're on the phone with them. So get your business organized. Step one, you need to increase your traffic, period. All of us do. No, none of us have a line waiting outside our office doors or phone calls piling up as we speak. How many leads do you have? How much do they cost? Get a marketing plan together. Step two, increase your appointment and your call ratio. Your leads versus your appointment set or your sales made. If you don't have that figure, create that figure. It's very important. For those of you that are on the CRM through Five9 or through SES and you want reports on this, please let us know, because we do run reports on how many calls you're making, how many appointments or follow-up calls you have, and then how many individuals you're actually closing. Increase your appointments that actually show, decrease your no-show ratio, and increase your closing ratio of some product. Doesn't matter if I call you for an MAPD and it ends up that you need a different product. Compliantly, we can figure that out. But it's so important that we make it through, and I can actually help you with something and make an income for that time in which I'm on the phone with you. It is a numbers game. Figure out and improve your numbers, and your income obviously will follow. This is a business, so understand that it's my job to be efficient as I can. I need to make dials and run meds. I need to make dials and pull up physicians. I need to make phone calls while I'm doing something else and reaching out or marketing myself. My time, your time, is money. Understand that. Once again, while I'm sitting in this office chair where I don't want to be on a sunny day, rainy day, I don't care what kind of day, I need to make money while I'm working and understand that my work The time in which I'm working needs to be as short as possible with the amount of revenue being as high as possible, which means we're back to efficiency. It means that we're going back and developing a well-scripted, predictable, and measurable sales process. And you need all three of those. I don't give free quotes. I don't give free information. If I'm on the phone with you, we're going to figure it out and we're going to move on, or you're going to start referring people to me. But one of those things needs to occur so I can make some revenue off of this time I just spent with you on the phone. I'm certainly never in the mindset that they'll call me back. We're going to conduct business. We're going to conduct business now. I'm going to figure it out with you now. We're going to move on with our lives, and I'm going to earn your trust in your business as a consumer and as a client because I'm a professional at what I'm doing. How many dials are you making a day? How many appointments? Or how many sales or how many applications are you taking a day or a week? What is your goal? We can always work backwards. I want to write 4 apps a week. Oh, okay, cool. I can tell you exactly how many dials you need to make, how many people you need to talk to, how many leads you need to buy. What is this ratio? It all comes down to a ratio. And once we figure out where your ratio is lacking, whether or not it's your closing skills, whether or not it's your professionalism, whether or not it's your phone script controlling the conversation, just providing free information, whether or not it's you buckling at the knees, mailing everyone everything that they ever ask for, and they never come back to purchase. Once we figure out where exactly your ratios are off, we can continue to tweak those. Did you make the minimum number of dials today? Whether or not you're dialing hot leads, mailer leads, we'll get into that shortly. Are you working enough? Are you putting enough? Working is not sitting in the office chair. It's making the dials, it's making the contacts, sending the emails, etc. Are you tracking your activity every day? How many appointments are you booking in a week or in a month? How many do you need to book to have the number of enrollments or disenrollments occur? And how can we help you decrease the disenrollments if you're having issues with a taken rate or a stick ratio? How much are you marketing per week or per month? All comes into play. So my question to you is, do you understand that 3% difference? And it is 3%. Between being great and excellent is only a 3% difference. So if you're working a 40-hour work week, figure out what 3% of that is. And you're probably talking maybe an extra 40 minutes every week to go from great to excellent. And more importantly, do you understand the income that you receive from going from great to excellent? So this is from the 2017 Bureau of Labor Statistics, showing health insurance agents, not Medicare agents, slightly different. The top 10% earned $125,000, but the median was half of that, less than half of that. They're all doing the same thing. What is the difference between 99, let me rephrase that, 97% of the industry, 97% is the median, 3%'s the top, technically 90%'s the median, 7%'s the bottom, 3%'s the top, figure however you wish. How do you move into that top 3%? That is the most important thing as you go into AEP, because in this industry, it's not what you do today that affects you tomorrow. It's what do you do today that affects you 18 months down the road. This is an 18-month down the road business. 18 months from now, I pretty much can assure you that their spouse is going to age in. 18 months from now, I start receiving my renewals. 18 months from now, I'm pretty sure that they have a sibling that's aging in. 18 months from now is what I'm looking at. How do I need to market myself and stay in front of someone so I can keep them for 18 months so I can hook the next person on that referral list? So let's prepare for AEP. Do you have your current and your past consumers organized? Do you have a book of your business? Do you know who's on your book? Do you know who fell off your book? Do you know who's waiting to enroll through the annual enrollment period or open enrollment period? Do you have a letter prepared to go out or a postcard to your current consumers? I will tell you, if you are mailing a letter, when you have that clear address area and you do not put a return address label on it, they seem to be opened more frequently. But you have to start gauging your open ratio and your call ratio by how many consumers are actually opening that letter or receiving that postcard. But you got to let your current consumers know that you're still alive and that you're still conducting business. All marketing should be completed and or out by 10/1, especially as a democratic duty. I'll leave the politics out of this. We really shouldn't be mailing much in the month of October. So my goal, once again, is to have all of my consumers touched in some fashion by October 15th. So the way that I do so is I make sure that they have a mailer piece on their front doorstep as early as October 1st. My mailers went out 3 days ago. I need to help as many consumers as humanly possible between that time period to obtain those referrals. I need to follow up with my sold consumers quickly to increase my AEP referrals. Did you get your cards? You get your paperwork? You get your cancellation letter from your previous carrier? Did you call and cancel your other med sup provider? Whatever the case may be, I need to touch them, so that way they have enough time to refer enough people to me and I can work them. I need to follow up with my, I already stated that, my apologies, Walmart, Kroger stores, PPE. Are you ready to go work these venues? Now, CVS I did pull off because obviously CVS is no longer this year. If you are working a venue, if you're going into any facilities by any means, make sure that you have some kind of statement stating that you're not going to be sued for walking into that facility. And secondly, if you are going out and about within these locations, beg of you, make sure that you have your PPE ready. Now, SES is delivering PPE to all the Walmart and Kroger stores nationwide on the 29th to help make sure that as of the 2nd, we're good to go. That is certainly a concern as we approach this annual enrollment period. Your certifications and your contracting, once again, we need to get that buttoned up if you have not gotten that buttoned up. Know your plans, your carriers, and the areas in which you're working. Many are moving into more of a telephonic role. So if you are moving into counties that you haven't worked before or states that you haven't worked before, reach out. We do have maps that show you where the DSNP, zero premium plans, etc. are, so that way you can narrow down and understand the carriers that you'll be discussing. Know how to write these online apps. Know the telephonic apps. Know who accepts a scope of appointment via text. Know who accepts a voice signature. If you need assistance with any of that, please reach out. Download the Ascend. Download the Lean. Download any other operating platform that you need to be able to successfully make it through a telephonic signature on an iPad, through Rate if necessary, or through Lean or any other platform that these carriers are offering. Read your emails as this is changing on a daily basis. Applications scanned and ready for email or mail if necessary. Have you ordered any applications? Do you have your Humana, your Aetna, your WellCare, Molina, HAP, Blue Cross, whatever it may be? Understand that Humana and Aetna have either a barcode or numbers on the bottom. It may behoove of you to scan in a dozen, 2 dozen, 3 dozen apps, so that way when you mail these applications out, you know that the entire application is safe somewhere, as oftentimes they only receive the signature back, or the signature pages back, I should say. So Aetna, Humana, get them scanned in, get them saved or labeled somehow, so that way when the time does come, if you do need to either mail or email an application to someone, you have everything together. Your draft emails, are they prepared and are you ready to send them? I have created draft emails for myself that as I go through and run consumers' medications or run consumers' Medicare Advantage plans, I send a very nice email out, but it's a draft every time that says, hello, Jeffrey, I have run your medications through Medicare.gov's website. Below, I've attached the findings from Medicare.gov. It appears as though that WellCare is going to be the least expensive overall costing plan for you. Click my PURL right here and enroll. So I don't even enroll half the consumers that I talk to. I expect for them to do that. I don't want to waste 20 minutes of my day having you go find your red, white, and blue Medicare card. Are you kidding me? I don't have time for that during AEP. So knowing your PURLs and having them saved, finding them. If you need to go into Blue Cross Blue Shield's website or Ascend's website or the carrier's website to get your PURLs, your personal URL that allows for you to send over that link to the consumer via email or via social marketing, what have you, to allow for them to complete that enrollment, for you to get paid, and for you to save 20 minutes or so, let's call it 15 minutes per consumer. If you're writing 8 to 15 consumers a day, that's a whole lot of time that you're saving. Your organizational list of consumers. Every year, begin keeping a list. Get an Excel spreadsheet. If you need help putting one together, certainly reach out, let us know. But that is something very, very important that I keep track of. And I expect as an agent that you do too, that if last year you were on a WellCare Elite plan, and the year before that you were on a Molina plan, and the year before that you were on a Humana plan for 4 years or whatever it may be, it's nice to be able to go back or at least glance and see, well, Joyce, you didn't like Molina because, and that's why we moved you to Humana, and now my recommendation is HAP or WellCare or whatever it may be. Your consumers want to know, we did not need the scope of appointment for the WellCare PURL. Is that the same this year? You never need a scope of appointment for a PURL, ever. I am sending this PURL to you via email, or I'm posting this PURL in an ad on Facebook. Understand that I have a bet with a carrier that we're going to write more on our PURL than the second largest HAP producing agency in Michigan. So we are HAP for the most part here in Michigan. Understand that we are the largest producing agency, and I made a bet with HAP that we will produce more through our PURL than the second largest HAP producing agency. It makes it so much easier for you as an agent to have the consumer. So let me retort. Let's go back. I've trained a lot of my consumers to email me a list of their medications. So by emailing me a list of their medications, I don't have to be on the phone with them during normal business hours. So I either pay someone to run their meds on Medicare.gov, search their doctors, etc., and then I scrub that information, agree with it or fix it, and then send it out to the consumer. So oftentimes this is via email. If your consumer has a smartphone, if your consumer has an email address, this is the easiest way to get that application completed. I don't care how good of a typist they are, they're able to go through that app and get it completed. So utilize and use your PURLs. And if you don't know which carriers offer them, as most of you here on this call are Michigan agents, HAP, Blue Cross Blue Shield, Humana, WellCare, all currently have a PURL. And that holds true for Blue Cross Blue Shield in other states as well. Humana, obviously being nationwide, but HAP being a Michigan product, has a PURL. So download your PURLs, have them handy. I'll show you kind of how to get through them if any of you need to after this call. But once again, that's how I get through my calls quickly. Half the consumers I train to just email me a list, or while I'm on the phone, hey, Bob, do you mind? Do you have an email address? I do. Great. Email me a list of your medications. Be as specific as you can. Dosage, frequency, the whole 9 yards. I'll scrub it for you. At this time, note, you're only an advocate. Anyone can go into Medicare's website, right? So all I'm doing is doing this with you or for you. But now we're talking a whole nother level when I have to complete the application with you or for you. And then I have to scan the application, store it for a decade, make sure I have a scope of appointment, et cetera, and then upload it. If it's SilverScript, you got to type all that into Silver, right? Nonsense. No way do I have time for that. Utilize your PURLs. Like I said, if you need help, I'll go through it briefly if we have a few minutes after this presentation. That is certainly something to help you automate your industry. So let's talk about how you can generate more business. One, your past consumers are a resource for you as you've already created trust within that relationship. Your current consumers, sometimes before the app is even issued, they're referring people to you. And how do you create that? You can change agent of record, right? You talk to someone and they're on a WellCare plan and they want to stay with WellCare and you concur that WellCare is the right plan. You can send them out a letter to the consumer. The consumer signs it. They write in their policy number. We submit it to WellCare, Blue Cross, whomever. You can steal someone else's consumer simply by being professional and honest with them. You can nab or steal other agents' clients, which is like the most favorite part of my day when the agent calls me and says, how do you take a client from me? You're not even in this county or you're not even in this state or whatever. I love that. So, nabbing, stealing another agent's client is easy if you are more knowledgeable and more professional. Go find new consumers, which is costly. We'll get into that in a moment. Work your referrals, work any of that book of business. Go market to professionals. So one thing that has worked out very well are receiving referrals from professionals. If you are not talking to your own primary care physician, your own cardiologist, your own GYN about what you do, shame on you. They need to know and they need to have a stack of cards. The best referrals out there are dentists, cardiologists. I mean, there's some amazing referral sprawls that you can create just by having an in with that doctor. Have an in with your client if they're even going to Oak Street or any other physician to walk in and have them know, listen, if you guys have anyone that has any questions about Medicare, you need to reach out to Joan. Joan is remarkable. She's professional. She's knowledgeable. Just send them all to her. She will take care of it all. That's what she does. She takes care of shit, right? She answers all questions on Medicare and she knows exactly her stuff. Walmart, Kroger, community events. Once again, on our last webinar, we discussed Oak Street Health expansions really across the east of Mississippi. So Illinois, Indiana, Michigan, Ohio, Pennsylvania, New York, soon to be New Jersey. Oak Street Health is a primary care physician's office. It's phenomenal. They're never late. Everyone gets a 20-minute booked appointment. If your appointment's at 1, they show up at 1. The doctor doesn't have to type or do anything on a laptop. They have someone who dictates. The place is clean. It's amazing, and it's a referral sprawl. All you have to do is just ask your consumer if they're nearby in Oak Street Health. Are you happy with your doctor? Would you like to take a tour at Oak Street? It's free. Why don't you just set up a tour? Go in, see what they have to say. Take a look at the place. They do offer transportation free of charge up to 12 miles away too. So any of these MAPD DSNP consumers, you refer someone to Oak Street refers someone to you, and that relationship continues to grow. There are a ton of ways to get in with dentists, especially on the DSNP side. If you have a dentist that offers Medicaid or DSNP consumers services, and a DSNP comes in and they don't have an additional plan, they just have Medicare, Medicaid, that dentist may not be able to cover that crown, that veneer, that implant, or whatever it may be that consumer needs at that moment in time because Medicaid doesn't cover it. Getting in with the dentist's offices, we've created Molina trifolds, United Health trifolds. They are specific to SES agents. If you want any of those to pass out or to mail out, or we'd be happy to mail out on your behalf to DSNP offices to have your name and number in a trifold sitting at the counter. So if the patient isn't able to obtain services, maybe the counter individual or the billing person can say, why don't you call this number? It looks as though you may qualify to have $3,000 of additional dental through Molina or $2,500 through United Health. Call them. Maybe they can help you. That's a huge way of generating additional business. And you don't even need to go into the dentist's offices any longer. You could just create a letter or pop in with your trifold, leave it COVID compliant, obviously, with whoever's answering the door, walk away and phone them back a few days later and see if they would like 20, 50 of them on their front counter. So who is a referral? A referral is a spouse to a client or a non-client, a sibling or a sibling-in-law, a specialist, primary care, dentist, health professional. Could be a friend of a friend. It could be a neighbor. It could be a colleague. It could be someone retiring or being laid off together. Let's talk about this for a second. The layoffs couldn't happen. We know this, right? Any organization that took the government grant couldn't lay anyone off or they had to pay it back. Layoffs are going to begin occurring hot and heavy. If you have airline pilots that are being furloughed, laid off, or let go early, here in Michigan, we have Pt3 retirees that are going to start getting early outs again or being paid to leave. Out in Delaware, Dow Chemicals is kind of imploding right now. There's a ton of retirees out there. If you can get in with that one retiree that then creates that referral sprawl, friends on Facebook, friends in business, whatever it may be, huge way of tapping into that. So let's talk about how much a lead costs for a second. If you send out 1,000-piece mailer, which is how much our mailer pieces are, they cost $530 on average, no color, generic black and white mailer piece. And right now, we're receiving just higher than a 3% rate of return, which means on a 1,000-piece mailer, we're receiving about 30 leads. And out of those 30 leads, as an average agent standpoint, you're looking at about a 25% closing ratio, meaning you're going to sell about 7 of those 1,000 people that you mailed. With an internet lead, if you choose to purchase hot internet leads, they're averaging about $9 each. Your closing ratio is roughly 1 out of 11, and your cost is about $90 per sale. So on a mailer, your cost is $76 per person sold. On a hot internet lead, it's $90 per person sold. Marketing obviously has a cost to it. It doesn't matter if you're doing a lawn sign, which for those of you in Michigan, my apologies, but this will be everywhere here in the next few weeks' time. Every Walmart, every Meijer, everywhere you'll see this. It's a lawn sign that's going up to obviously increase the Medicare, Medicaid, or LIS consumer. Now, when we send out a mailer piece, the one thing that we do is we take that mailer piece and we send out a magnet to every person that we get back. So as we receive these 30 leads, the one way we increase our 25% closing ratio is we send the lead back to the consumer. Here's your lead with your handwriting, with your ink. Here's a nice bifold with a magnet. If they don't need our help now, not a problem. We're patient. But I want a magnet on every one of their refrigerators. So understand what you're paying. Doesn't matter how you're paying for it, but you're paying something for those leads that come in. So let's talk about a referral. What does a referral cost you? First and foremost, it's a lay down sale 99% of the time. My buddy Bob told me that you sold him a United Health Plan G. I want that too. My sister Janice says that she's on Melina. I want that too. So, one, you create a whole lot more time in your day because you're not generally playing phone tag or with any lead. You're calling them 2, 3, 4 times before they actually get off their Davenport, go out and call you back or need assistance. Timing's everything. With a referral, they don't call you until they're ready. So I don't have to waste time making follow-up calls, trying to reach someone. My phone just rings, a referral comes in, and I know with that referral, most of the time they're ready. Listen, I need coverage to begin October 1st. Don't hate me. I know I'm late, but can you help me? Yeah, 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 I can help you. Great. My sister Janice said you're amazing. And so at that point in time, you have a sale. So how much time does that alleviate making voicemail after voicemail or call after call? Every referral I've ever had in my life gets a $10 gift certificate, either generally to Wendy's or generally to Tim Hortons. And I've been doing more Tim Hortons just kind of because of COVID and the whole beef issue and everything else. But every consumer gets a $10 referral gift card and a thank you card and more of my business cards. So, what I'm spending as an average cost on a referral is about 12 bucks. I send a thank you card to the consumer who referred me that person. Bob, thank you so much for the referral of Janice and Tom Hodgkins. I will provide them the same professionalism that I have shown to you. Thank you for having the trust and providing me that consumer. Let me know if there's any questions or anyone else that you run across that may need my guidance. And then he's going to pass out more cards. The man just got $10. And to some consumers, 10 bucks is a lot. I fed a family once for a month on Wendy's gift certificates. I'm not joking. So that $10 to them means everything. That handwritten thank you card, dollar store, 4 for a buck, super easy to come across. I don't write out my cards. I haven't written out cards in a decade. I pay someone else to I didn't say it was my handwriting. It's a handwritten card. And so a card goes to the consumer who refers them to me, more business cards, and a gift certificate. The consumer I just sold obviously always gets a handwritten thank you card and business cards. So that way they can do the same thing that their buddy just did, which is pass my name out to anyone and everyone that needs assistance. So if the average lead cost is $76, which is kind of on the low end, and the average referral cost is 12 bucks, if I sell 100 referrals a year, I just save $6,400 in marketing, plus a tremendous amount of my time and aggravation trying to convince someone that I need to sell them because they're a cold lead, an old lead, a mailer lead that, right? Like, who are you? And I just got your letter, etc. I would much rather, and I'm assuming all of us on the call would agree, I would much rather sell a referral any day of the week and 5 times on Sunday as opposed to marketing, because it's a stronger lead. You already have trust, confidence. That sale comes so easily. We are running a little out of time, so we have a couple slides left. Referrals must come from a known and trusted source. Let's begin there. You're able to obtain more referrals because you're going to provide better service. Many consumers are left in the cold. They're sold and dumped. Think about all the agents at the Walmart stores, the CVS stores. Think about the call center agents that only last a year at their job and then they leave. These consumers are left in the dust. And if you can prove to them that you're not going anywhere, you'll have someone for life. You have better knowledge. You've read the Medicare and U-Book 2021. It was released a week ago. I hope to God all of you on this call have read it. If you haven't, you have a weekend coming. You have better knowledge on enrolling them, on the ins and outs of the product, the network that they're going to run into if issues, the rate increases that the carrier has had over the last few years. You have knowledge on what you're enrolling that consumer into. More importantly, even if you don't, you show that you care. You care about this member. You care about your community. And they'll let others know that you are this caring soul out there. You're still going to make the sale, but you don't need to be a salesman or woman to make the sale. You're going to be more professional than anyone else out there. You're going to keep your appointment times. I make appointments, even if it's over the phone. My time is valuable. If I call you at 2:00, we're talking at 2:00. As an agent, as a consumer, if we book an appointment, I assure you I'm within 2 minutes of that call, 2 minutes of picking up my kid. I am going to make sure that I am that professional out there that's going to be prompt, that keeps my appointment times, that never has a full voicemail, that's going to operate a business as a business. Does your client have a way to refer you to others? Have you made sure that they have your business card, that they have your magnet, that they have your folder? If you've decided to create a Medicare folder that, hey, after the appointment, you can have, well, really with pretty much any carrier on the Med Sup life insurance side, you could have all of their apps or insurance documents come to you, and then you would put it in a folder, put it in your envelope, and then send it out to them. There's a lot of agents that create health folders or Medicare folders to make sure that your name, email, whatever is on the front of this. The point is, does the consumer have a way of making contact with you? And my goal is, no, they don't. My goal is that they've passed all of my cards out and they're calling me for more. And they do that because they left them all at the community center. They left them all here. You can create that referral sprawl, and you can create an army of seniors out there marketing for you. And once you do that, gloves are off. You have the whole community center loving you because Bill and Jean came in and said, you got to love this guy. He's amazing. And you talk to 2 or 3 others and spreads like wildfire. The other way I generate your referrals, low income subsidy, extra help. If you do not know what this is, scrub up on it. Single income under 18, married income under 25. Many consumers may qualify for low income subsidy and don't know it. So that's a very simple question. Hey, do you make less than $1,500 a month? Do you make less than $2,400 a month? And in doing so, that allows for me to gauge or know where that consumer is. So briefly, 5 things Extra Help provides: a percentage, 25, 50, 75, or 100% off their Part B premiums. If I can free up that $144.60, your Part B premium, on an annual basis, I just saved you $2,000. Why wouldn't you buy from me, and why wouldn't you refer me out to everyone else? I did something no one else has done. 8 years you've been in Medicare and no one's talked to you about this. And now I just saved you $2,000 minimum. You're going to refer me. It allows 1 quarterly SEP until October 1st, provides fixed co-payments on your prescriptions. See summary benefits, obviously, for each plan, coverage through the donut hole, and no late enrollment penalties. I talk to everyone about Extra Help low income subsidy. Hey, Craig, not to get too personal with you, but do you make less than $1,500 a month? No, I make way more than that. Okay, I just wanted to see if you qualify for anything. Bring it up. And if you can help someone save on their insulin, their prescription drug costs, their prescription drug premium, their Part B premium, that is your referral wildfire waiting to happen. They will refer you out to anyone and everyone. So understand, there's about 50 steps that need to take place when creating and generating and earning your referral. You need to be prompt, knowledgeable, professional. You need to set the expectation of what's to follow. I mailed you an app. I'm going to follow up with you on Wednesday to make sure you received it. I submitted your app. I'm going to follow up with you within a week's time to make sure that you're approved. That expectation of what's to come is incredibly important for these seniors. You're going to receive a card from me. It's handwritten, not my handwriting. It's handwritten with my business card. So you have a way of referring me out and you have a way of contacting me. My office generally also sends out another thank you card with a magnet attached. So that way you can throw it up on your fridge or your back door, but you always have a way of making contact with me. Follow-up calls, making sure your voicemail, once again, is never full. Handwritten thank you cards, returning that consumer's call, even if it's the 8th call in 30 minutes, you need to return it back to them in a prompt fashion. Stability, longevity, they want to know that you're not going anywhere. They want to know most of the time that they are dealing with someone who's going to outlive them and going to be here for them for years and years to come. Otherwise, they're never going to refer anyone to you if you're like, hey, I'm planning on retiring in 6 months. You lost it. There's no referrals. So understand that consumer mindset. You have someone come out and do any work on your home or fix your roof or what have you, they need to do an exceptional job for you to give them an exceptional Google review or an exceptional referral, which is the best thing that can happen out of this sale. Friendly versus professional. Some agents are incredibly friendly and they don't know squat about the industry, but they still make sales. Some are incredibly professional, but they're not very friendly. You figure out how to do both and you will become unstoppable in this industry. So your follow-up, if you don't have a follow-up sheet, make one. Create an Excel spreadsheet. Do something. Create a calendar event or an activity or whatever program you're using or whatever disposition it's called to make sure that you're following up with these consumers in a timely fashion. Make sure to follow up and stay in touch with them because they don't not only pay your bills, but their referrals do as well. That is your referral base. Immediately after the sale, handwritten thank you card goes out with my business cards. Follow up with the consumer when I find out approved, right? Hey, Joyce, you got approved. Expect your cards, expect your paperwork. I follow up again once I get paid. Once again, you got my business card, you got my thank you card, everything's good. Now is the time that I've earned the right to ask for that referral. I've made enough phone calls, I've done enough follow-up, I've done enough follow-through, I'm enough of a professional. Now I can ask them, is there anyone else that needs help? When's your husband aging in? Whatever the case may be. Then a magnet and a thank you card get sent. And then I also obviously send an AEP postcard. And I also send a Christmas card every year to all of my consumers. I stay in touch with them. So my question to you is, do you have business cards? Do you have enough business cards? Is your voicemail or your phone full? And if it is, reach out. There are ways, programs, Google Voice, whatever, to make sure that you never, ever, ever have another full voicemail again. Do you have handwritten thank you cards? If not, start at the dollar store, 4 for $1. Have someone start writing them out. Save the pen, preferably that it was written out on, so that way you can just add the person's name, throw it in an envelope, and move on with your life. Your follow-up call made once the policy is issued. Your follow-up call once the policy is paid. Did you leave a magnet on the consumer's fridge, or do they have a magnet to reach out to you? Main contacts. We will be doing an SES e-blast here shortly, letting you know the main contacts of where you should be reaching out, because as we continue to grow, there's been a little confusion. Once again, I'm the principal here of SES. Teresa Rogers heads our agent services department, handles our life insurance and annuity department as well. Jasmine Leopold handles our contracting. Angela Schwartz handles all of our enrollments and compliance. So if you are sending up a paper application, if you mail out an application, she's the one that sends you over your applications. If you stop by the offices, our Waterford office has a drive-through, so you can always stop by, Throw your application in the drive-through. We'll scrub it and submit it to the carrier if you don't have a fax or you don't have a means of submitting that application. If you ever have a compliance issue, an allegation, you need assistance in explaining what happened at that appointment or over the phone, she is the one that will assist you in regards to creating your information or your rebuttal, if you will, back to the carrier. Ellie is our internal Medicare specialist. She's incredibly knowledgeable when it comes to any of your union coverages or any wonky Medicare questions. Obviously, the main hubs, if you will. If you have a question with commissions, email commissions@seniorenrollmentsolutions.com. The main hub for SES on the agent side is agent services at seniorenrollmentsolutions.com. Contracting, obviously, is contracting at seniorenrollmentsolutions.com. All of the contracts are still on the SES agent portal. If you're missing someone, if you can't get into a certification, etc., please reach out. Obviously, my email is John at SES, Teresa's is Teresa at SES, Jasmine's is Jasmine at SES, and so on and so forth. Lastly, for those of you attending, over the last few years, we've been putting on workshops, and I so appreciate you coming on and gathering some knowledge, and hopefully this wasn't a huge waste of time, and I'm on time, which is, once again, why we remain professional, is because we stick with our word, right? I tell you an hour, I'm on an hour, but we do spin a wheel. We put your names into a hat. If you win a prize that we cannot mail to you, we will email you and either come up with a means of picking it up or getting it ordered. But we do spin a wheel for those of you on. We came up with this because obviously the last few years we would actually have to rent a venue, order food, feed many agents, and frankly, this has saved us a tremendous amount of money, which we want to reward you with and to help you increase your business. So whether or not it's a gas card, an iPad, $1,000, 1,000-piece mailer, etc., we'll spin the wheel for you for those of you that remain on. Last slide. Once again, thank you all for attending. We have 2 more webinars coming. 2 last webinars, I should say. October 1st is Aetna. If you do not know of the expansions going on with Aetna, the DSNP expansion specifically here in the state of Michigan, October 1st is the Aetna webinar that we're putting on. And then we may have another webinar, which will really just be a telephonic call for a new carrier for those of you working the Illinois or Chicago market. Lastly, there were questions that kind of popped up in different screens about our last webinar. Yes, I actually wrote a book. Yes, it is going to be out October 15th or earlier. Yes, it will be filmed. I found a fairly professional person to film it. So I wrote the book on Medicare. Hopefully, we all can write the book on referrals and increase this business. I beg of you, work that referral book, but do not be overly aggressive in working it. There's a tactful way of massaging your current book of business to generate additional business. If you have any questions, text us, preferably on the 24-hour text line, email us, Skype us if you so choose, phone us, reach out to us if you have questions about any carrier contracting, any certifications, any expansions that are going on, any carriers that you should not have, anything. I will keep this chat room open or webinar open for the next 30 minutes. If you have any questions, reach out to me directly, put it in the chat box. Let us know how we can help you get prepared, because in my eyes, I have 6 days left. Not joking. I'm on 20-hour days right now trying to get my AEP prepared and trying to help you prepare your AEP as well. Time is of the essence. Make hay while the sun shines, right? The sun only shines for a very brief period of time when you're discussing the AEP, OEP time period. So take advantage of that. And if you need help in marketing, letters, postcards, whatever it may be, please reach out. At this point in time, I'm going to end our recording and end our webinar. I think